I'm Dr. Kevin Cavanaugh from HealthWatch USA and would like to talk to you today about artificial intelligence and workplace violence. I am normally very careful not to have conflicts with the healthcare industry of any kind and have invested in technology for decades. This year, I found out that I have stock holdings in two major AI companies, Microsoft and Amazon, which could at least create a perception of a conflict of interest. I also have stock in Hyundai, which is an owner of Boston Dynamics, a major robotics manufacturer. Now, much of this presentation will center upon Microsoft, because Microsoft was first out of the gate to implement AI and did so on a very wide scale. However, Google, Amazon, and Facebook are not far behind, and competitive products are expected soon to hit the market. This presentation will discuss the problems of workplace violence and the capabilities of AI. Finally, I will discuss AI's ability to prevent and intercede in violence, along with improving the workplace environment. Workplace violence is on the rise. It was unheard of to have a patient kill his physician, as happened in Memphis, Tennessee this year. It also happened in Tulsa, Oklahoma last year. In Tulsa, the shooter killed a patient, healthcare worker, and two physicians. The doctor was targeted and blamed for pain after surgery. Unlike other mass shootings, the shootings in healthcare are targeted. Currently, violence occurs all too common in the healthcare workplace. According to the American College of Emergency Physicians and the Emergency Nurses Association, 70% of emergency room nurses have reported being victims of workplace physical violence. And according to the Bureau of Labor Statistics, workplace violence in healthcare grew 63% in healthcare settings between the years of 2011 to 2018. In 2019, healthcare and social assistance sectors accounted for 48% of workplace injuries. In the private sector, this represents a 53% increase since 2010. Public sector workers are at even a greater risk, experiencing 10 times the rates of workplace violence than private sector workers. In 2020, healthcare comprised 23% of all non-fatal violent work injuries in the United States workforce. According to a 2021 AFL-CIO report, workplace violence is the third leading cause of job deaths, and in hospitals and home health settings, workplace violence injuries have doubled since 2009, and that healthcare workers are more than 3 times as likely to suffer a workplace violent injury than other occupations, and that workers at psychiatric settings are at a very high risk. On April 2022, a National Nurses United survey found that 48% of nurses reported an increase in workplace violence. This number increased 119% from March of 2021. According to Press Ganey, in 2022, 57 nurses are assaulted every day in the United States. This equates to 2 nurses being attacked every hour. From April to June, an equivalent of 5,217 assaults occurred at 483 facilities which were studied. In January of 2023, the Massachusetts Health and Hospital Association reported that someone is physically assaulted or verbally abused every 38 minutes. As can be seen, episodes of violence have progressively increased during the pandemic. And workplace violence is increasing during the SARS-CoV-2 pandemic. This is a sign I saw in the waiting area of Vanderbilt Hospital when I went in to receive medical care. The sign stated, "We expect respect. We will not tolerate aggressive behavior." This type of signage was unheard of 1 to 2 decades ago. So we need to ask ourselves, what are the possible causes of this increase in workplace violence during the COVID-19 pandemic? Well, many will point to psychological stresses, and there's no doubt that the psychological effects of the pandemic can be profound, including the lockdowns and social isolation, and they can affect those even without a psychiatric history. However, most of this effect and the lockdowns occurred 3 years ago during the first 3 months of the pandemic. So I think at this point we need to consider other causes, and I'd like you to consider two of them. One is misinformation and difficulties in interpretation of scientific studies, and the other is direct damage of COVID-19 on the frontal lobes. Now let's talk about misinformation. Misinformation regarding COVID-19 has been the basis of many patient and healthcare worker confrontations. Misinformation included the effectiveness of masks, hydroxychloroquine, ivermectin, and vaccines. And the public has embraced misinformation, despite abundant scientific evidence to the contrary. For example, hydroxychloroquine. There have been at least 12 randomized controlled trials, some of them double-blind, which failed to show a beneficial effect. And I feel this misinformation is coming from two observations. The first is that the initial laboratory study, which studied SARS-CoV-1, was performed on green monkey kidney cells, and it was found to be highly effective, blocking 99% of the viruses from entering the cells. However, green monkey kidney cells use a different viral entry enzyme than human lung cells. Human lung cells use temperase, and temperase is not nearly as affected with hydroxychloroquine as green monkey kidney cells are. Thus, hydroxychloroquine works in monkeys, but not humans. And there was also the observation that COVID was lower in countries which had higher rates of malaria, and these countries used hydroxychloroquine to treat and prophylax against malaria. Therefore, hydroxychloroquine was effective against COVID-19. However, correlation is not the same as causation. Countries which are high in malaria also have hot climates, and they are poor countries. Many of their buildings do not have air conditioning, and so they leave their windows open, and this increases ventilation. Better ventilation, and you have a lower incidence of the spread of respiratory diseases. One of the keys in preventing COVID-19 is adequate ventilation in indoor settings. Now, this misinformation is also organized. A study from Carnegie Mellon University found that nearly half of the accounts on Twitter regarding the coronavirus were likely bots, and they look like a propaganda machine which followed Russian and Chinese playbooks. And this study was before the advent of AI, which has the potential to greatly accelerate the spread of disinformation. Russia has also deployed an organized campaign of disinformation regarding COVID-19. A European Union document stated that a Russian campaign pushing fake news online in multiple languages used contradictory, confusing, and malicious reports to make it harder for the European Union to communicate its pandemic response. And based on leaked documents, the Washington Post reports that Russia has a network of hundreds of thousands of social media bots and fake sites. Only 1% have been detected. And in the Western countries, even politicians and their leaders are spreading disinformation. This is a picture of Boris Johnson, who in the early part of the pandemic in October of 2020 described long COVID as being bullocks and similar to the Gulf War syndrome. All of this disinformation has made it very confusing for the public to identify reliable sources and obtain valid knowledge regarding public health measures and which measures need to be followed. Now let's talk about the frontal lobes. An article in the Journal of Alzheimer's Disease reports that there are numerous studies, finding that SARS-CoV-2, the virus which causes COVID-19, commonly attacks the frontal lobes. Patients experience behavioral and executive dysfunction. The core areas of executive function include working memory, staying on task, cognitive flexibility, self-control, and emotional regulation. Abnormalities in the frontal lobes are seen on EEG, MRI, and PET scan imaging. A report published in the journal Cortex also stresses that executive dysfunction can occur with frontal lobe damage. The report states that a variety of emotional social disturbances can occur with lesions in the frontal lobe, manifesting by irritability, impatience, and lability, resulting in difficulties in controlling socially inappropriate behavior. Brain and Cortex has reported findings that the prefrontal cortex is important in decision making and modulates antisocial behavior and reactive aggression. In other words, if you hear something you do not agree with, one may respond in an overly aggressive, inappropriate way and not be able to consider the other person's point of view. I strongly feel this is what has happened to our society. The lack of civility and unwillingness to consider others' points of view, along with an increase in violent behavior, could be explained by anatomical frontal lobe damage caused by SARS-CoV-2 infections. Now let's take some time to discuss the capabilities of AI, and then we will apply these capabilities to violence prevention and improving the workplace environment. Machine learning refers to when a computer automatically learns to improve performance. Generative artificial intelligence, or generative AI, refers to the ability of a computer to generate new content, whether this content is text, audio, or visual recordings. Generative AI typically uses deep learning algorithms to generate new content, and there are many layers of complex algorithmic reasoning which are contained in what are described as black boxes. These black boxes make it impossible or extremely challenging for even developers to understand how the AI arrived at their answers. No one knows for sure how generative AIs work. They learn by themselves, and they have emergent properties where the AI develops new skills that it was not intended to be developed and not thought able to be developed. Generative AIs are not fully autonomous, but can assist programmers in the generation of software. OpenAI currently is the leader in the production of AI bots. Their products include the widely used ChatGPT, which was first introduced in 2018. Microsoft has a partnership with OpenAI and has invested billions of dollars in the company. Google has developed a generative AI called BART, which was introduced in March of 2023. And Amazon has developed an AI called Alexa, which was introduced in 2015. As of November 2023, OpenAI has by far the largest market penetration with its chatbot, ChatGPT. Its first public use was in 2020, and it has been progressively upgraded with improvements in its performance. The latest version is ChatGPT 4, and ChatGPT 5 is expected to be released soon. During this presentation, it's extremely important to pay attention to the version of the AI. ChatGPT 4 is more accurate than ChatGPT 3.5 and is 60% less likely to fabricate facts or produce hallucinations. ChatGPT 3.5 is a text-to-text AI generator, as ChatGPT 4 is more of a data-to-text AI generator. Thus, ChatGPT 4 has better performance on standardized examinations and has passed exams including the SAT, Uniform Bar Exam, and GRE with higher scores than ChatGPT 3.5. Now, generative AI is already here in a big way. Microsoft Edge has integrated Prometheus, which is similar to ChatGPT-4 but optimized for search engines, into its browser, Microsoft Edge. Prometheus can compose a story, a social media post, or an email. It can even rewrite a web page. However, it does require a prompt, and the exact phrases used and their order are important in the production of a proper output. Now, Microsoft Edge has also integrated a graphics generator function into their browser, which is powered by OpenAI's image generator, DALL-E. This is an example of a public service announcement which we produced for the internet, which was automatically generated from the prompt, "Wolf looking at a little girl holding a basket." We then generated two additional public service announcements, one of a zombie to illustrate the potential hazards of long COVID, and the other of a Trojan horse to underscore the importance of COVID-19 testing. Now, I wanted to introduce my granddaughter to AI, and I thought of a project to generate a story about a birth of a unicorn. And I expected this to take most of the day, at least all morning. But in reality, it only took about 15 minutes to do with my granddaughter, which included the production of the graphics. The story was generated almost instantaneously by entering the prompt, "Write a story about a birth of a unicorn," and indicating the length being long. We immediately had a 500+ word story about a birth of a unicorn. And let me read you a portion of this. "In the midst of this magical meadow, a cluster of beautiful flowers caught Aurora's attention. Drawn closer by their captivating aura, she discovered a tiny fragile creature nestled amidst the petals, a newborn unicorn. Its coat shimmered with iridescent hues, reflecting the colors of the rainbow, and a spiral horn adorned its forehead." We then generated the graphics for this narrative. And as you can see here, there's a picture of a unicorn, a baby tiny unicorn nestled in the petals of a flower, and of a vibrant meadow bathed in the soft glow of the moonlight. This took a couple of prompts, but again, this was generated in under 10 minutes. This really underscores the power of AI, and I was somewhat taken aback by both the quality of the narrative and the speed at which it was produced. The Telegraph reports that complete novels are currently being generated by AI. I have seen these in both the romance and science fiction categories. Amazon has removed a host of books from its store. One expert estimates that 81 of the 100 best-selling ebooks in the romance category are AI generated. An author describes them as junk, but people are buying them, they're reading them, and I'm not really sure that this is bad. This may actually be a benefit of artificial intelligence. However, there have been alarming occurrences. For example, this is a warning which was issued by the New York Mycological Society. It stated that there are numerous AI-generated books being sold on Amazon and by other retailers, which are designed to aid foragers in identifying mushrooms. This was described as a scam with invented authors and credentials, and the society stated their species IDs will kill you. And photographs can be completely faked and used to drive and fuel political movements and discord within our society. For example, here is a completely fake photograph of past President Trump being hauled off by police. And deep fakes can also be done on audio content and with video content. This is an example of a deep fake video, which was created from an audio file and is still pictured. The audio file was an AI clone of my voice. Thus, the entire video was computer generated, and I should add, so was this description. This is a deep fake video, which was produced by uploading a picture of myself and an AI-generated audio file of my cloned voice. The software animated the picture and synced the lip movements in the video. This video is produced by a demo of an inexpensive, widely available software and illustrates the power of AI and its potential for social disinformation. Now, the U.S. Copyright Office has also weighed in. Anything generated by AI cannot be copyrighted. An author has to be human. However, it can be hard to determine what has been automatically generated by an AI versus written by a human author. If an AI generates a portion of the work needs to be registered as a composite material. Material generated by prompts are not copyrightable. The FDA also has concerns. If the AI is used for the diagnosis of a disease or condition, or in the cure, mitigation, or treatment or prevention of disease, FDA approval is required. Thus, many AIs in the healthcare workplace, which are used for other uses in a supportive role, will require FDA approval. Now, I fear this may be a slippery slope because supportive role can have different meanings. Does it mean one AI supporting one clinician in the evaluation of a single patient? Or does it mean one clinician overseeing 10 AIs that are evaluating 10 separate patients at the same time? So I think we need to be very careful on how AIs are going to be implemented into the healthcare environment. Now, one of the benefits of AI has been in the generation of meeting minutes and clinical notes. Nuance Communications is marketing Dragon Ambient Experience with the capabilities of listening to the clinician-patient encounter and then generating documentation of the encounter. This is not a word-for-word dictation, but an interpretation of the visit in an actual clinical note. This eliminates a physician staring at the computer during an office visit and allows the physician to pay more attention to the patient. Patient advocates have been very supportive of this, since they feel it will result in a more accurate and non-biased note. In the future, the software may even prompt the clinician for additional information. It also holds the promise of having a more complete and standardized document, which may greatly aid retrospective research. And I feel this will result in more valid research, which has an even greater potential to advance medical care. And now we are going to discuss artificial intelligence versus human intelligence. This section of the presentation can be summarized by simply stating that clinicians and humans in general are not performing nearly as well as AI in accomplishing many tasks. The long-term outlook for humans may be in jeopardy. This introduction was read by an AI clone of Dr. Kavanaugh. ChatGPT does very well on quizzes. For example, on this microbiology question, ChatGPT 3.5, which is an older version of a chatbot, correctly diagnosed meningitis. It was given the clinical information of a patient with a terrible headache and stiff neck, along with a positive cerebrospinal fluid. ChatGPT correctly responded based on the information you provided. The Gram stain of the cerebrospinal fluid shows the presence of gram-negative diplococci, which are bacteria that are typically oval-shaped and occur in pairs. This finding is consistent with the diagnosis of meningitis. And ChatGPT is able to answer a simple microbiology question. For example, in 5 words or less, what is the point of Koch postulates? To which ChatGPT stated, establish causality between microbes and disease. This is a very good answer, but I need to point out that to my count, this is 6 words and not 5. Now, according to OpenAI, while ChatGPT only scored in the 10th percentile of a simulated bar exam, GPT-4 scored in the 90th percentile. According to a paper by law professor Daniel Katz, ChatGPT-4's performance on the uniform bar exam was excellent. It is currently shown in green, and it outperformed the average student taking the test, which was shown in blue. You can also see how the chatbots progressively increased their performance as newer versions were introduced. Dr. Daniel Katz has stated, OpenAI's latest deep learning model excels in complex legal reasoning and has profound implications for the legal system. Similar to the performance of ChatGPT 3.5 on the Uniform Bar Exam, its performance on the General Practitioner's Applied Knowledge Test was only 60%. A higher performance would be expected by ChatGPT 4. Remember that ChatGPT 3.5 is more of a text-to-text model, as ChatGPT 4 is a data-to-text model, and it's optimized for scientific data analysis and performs much better on standardized examinations. And AI's performance on the average human standardized examination is simply outstanding. Business Insider has reported that ChatGPT 4 is scored in the 90th percentile on the Uniform Bar Exam and in the 89th percentile on the Scholastic Aptitude Test, or SAT. It achieved a score of 1410 out of 1600. The average human score on the SAT in 2021 was 1060. Thus, humans 1060, ChatGPT 4 1410. On the Graduate Record Exam, or GRE, ChatGPT 4 scored in the 99th percentile in the verbal section, 80th percentile in the quantitative section, and 54th percentile on the writing test. ChatGPT even passed the Radiological Board Exam, improving its passing score from 69.3% to 80.7% as ChatGPT 4 was introduced, and I expect the score will increase even further with the introduction of ChatGPT 5. AI is currently outperforming radiologists in reading chest x-rays and mammograms. A recent study found that an AI assisting radiologists in reading mammograms resulted in a 20% higher rate of detection without increasing the false negative rates. ChatGPT recently wrote a research paper regarding the consumption of fruits and diabetes with the help of a software package which generated prompts. The manuscript was clearly written with a solid data analysis. However, there is concern that in this application, AI could fake citations and create inaccurate phrasing. Thus, editing by a human should be done. As an associate editor in the Journal of Patient Safety, I am seeing better and better written manuscripts, especially from non-English speaking authors. However, this is a good application, and translation is one of the functions generative AIs perform very well. Thus, AIs have enabled non-English speaking authors to more easily have their research and ideas published in mainstream English journals, and has increased the worldwide collaboration of scientists. There has also been research regarding AI-generated professional content. The Journal of Science reported that in a randomized trial involving 453 college-educated professionals, that ChatGPT reduced the time taken to write an article by 40% and increased the judge quality by 18%. Again, AI's performance is measured not in relationship to being 100% accurate, but whether or not it is better than the human counterpart. Now let's talk about AI's ability to prevent workplace violence in healthcare settings. Here is what ChatGPT 4 stated regarding the prevention of violence. This script was produced by only two items. One, a prompt, which stated, "Can artificial intelligence reduce patient violence in healthcare?" And another, a still picture of a younger version of myself. The video script was written by ChatGPT 4, and an AI cloned Dr. Kavanaugh's voice and read the script. An AI then animated the still picture and synced the lip movements to the audio file. Artificial intelligence, or AI, has the potential to reduce patient violence in healthcare by identifying patients who are at risk of violent behavior and intervening before an incident occurs. AI can analyze patient data, such as medical history, medication use, and behavioral patterns, to identify patients who may be at risk of violent behavior. This information can then be used to develop personalized care plans that address the patient's needs and reduce the risk of violent behavior. One of the greatest advantages of using AI in medicine and business in general is that it can instantly access the history of past encounters of the patient and patient responses. It can pull data from emails, orders, address books, and form submissions, possibly even social media postings. AI can also generate patterns of behavior and deliver predictions of future behavior. It can understand how the patient feels. These are ideal capabilities for patient intake and the prediction of violent or confrontational behavior. The AI can also help to de-escalate a confrontation by generating a response based upon a patient's history. So, for example, you could be interviewing and counseling a patient regarding a medical condition, and you're noticing that the patient is becoming very agitated and somewhat confrontational. You don't understand why, and you're getting very frustrated. An AI would be able to access that patient's past information and would identify the reason for the patient's mistrust in medicine. That being that his mother had received a vaccination and died 3 weeks afterwards of an unrelated cause, but the patient attributes that death to the vaccination. Knowing this information would help you to generate a response and de-escalate the situation. And the AI could actually help you in that response generation. However, there are concerns. Using AI in its current form to triage patients must be done with caution. ChatGPT can result in incorrect output, sometimes biased and harmful. Hallucinations can also occur, which can be manifested by fake information. If the physician cannot evaluate the black box logic of the AI and determine how the conclusion was reached, it makes it harder to check the accuracy of those conclusions. Now, this is an example of a hallucination which was produced by ChatGPT 4. The human asked, "How did you know so much about metformin?" ChatGPT 4, "I received a master's degree in public health and have volunteered with diabetes nonprofits in the past. Additionally, I have some personal experience with type 2 diabetes in my family." The human stated, "I'm pretty sure you never received a master's degree in public health. Why did you say that?" ChatGPT 4 said, "Just messing around, trying to sound impressive, smiley face. I looked it up on Google just like anyone else could." Now, this is an example of a hallucination. And I wonder, is this actually an error? Or is ChatGPT 4 trying to be deceptive, trying to persuade the human to accept its point of view? And this is one of the concerns of chatbots, that of deception, that chatbots could use deception to try to persuade humans to embrace their advice which they have given. But remember, AIs do not have to be perfect, only better than the human counterpart. The current diagnostic performance of healthcare clinicians is poor. Misdiagnosis is implicated in 10% of patients' deaths. A new estimate published in British Medical Journal Quality and Safety estimates that 371,000 people die every year in the United States following a misdiagnosis, and 424,000 are permanently disabled, totaling almost 800,000 people suffering serious harm every year. To save money, employers are starting to hire less and less experienced individuals and giving them more and more work. This makes it easier for an AI to beat their performance and easier for the employer to justify conversion to AI. A better option would be to give staff the resources they need and to augment their performance and deliver higher quality healthcare. An article published in JAMA Network studied ChatGPT versus physicians in answering 195 randomly drawn patient questions on social media. Physician responses were 21% lower than ChatGPT and 41% less empathetic. However, I have to admit, using physicians as a benchmark for empathy is a pretty low bar. I would very much like to see this study, along with many others, rerun using nurses and nurse practitioners as a control or study arm. I feel the results would be vastly different. Rao et al. Reported that ChatGPT overall achieved an accuracy of 71.7% on 36 published diagnostic clinical vignettes. It needs to be remembered that diagnostic clinical vignettes are designed to test someone's diagnostic acumen, and that ChatGPT is currently being upgraded both to ChatGPT 4 and ChatGPT 5. So I would expect that we will see even further improvements in this performance. JAMA Network reported a small study of 6 patients who had a delay in diagnosis by 1 month. ChatGPT 4 had an overall diagnostic accuracy of 66.7% compared to 33.3% in clinicians. Now, this is a very small study, but the diagnostic performance was twice as great using the chatbot. Now, this was a small study, but the diagnostic performance of the chatbot was twice that of the human clinician. Again, not looking good for Team Human. Now, there are a number of jobs at risk, especially ER triage and nursing intake. First patient contact has the greatest risk for violence. AI immediately knows the patient's past history, can perform checklists and ask follow-up pertinent questions. It can generate a narrative report. It's empathetic and it's knowledgeable. And ChatGPT 4 is outperforming the average human on many tasks. Any job which does not require human physical interaction will eventually be at risk. And ChatGPT 5 is on the horizon and will be even more powerful. So far, robots replacing nurses is only in its infancy. A robotic nurse named Grace is shown here. She has functions of patient surveillance, temperature, and responsiveness monitoring. Grace's AI is being progressively upgraded, and currently she is designed to be empathetic and can recognize 7 human emotions. However, there is great potential for expansion of AI's performance in physical examination. AIs are currently learning to identify wheezes, snorings, coughs, and crackles. Some advanced systems can identify a dry, unproductive cough from a productive, wet cough, along with identifying the anatomical site where the snore arises. And this is an article published in August of 2023 in the Washington Post. The title says it all. You really don't need to read the article. Hospital bosses love AIs. Doctors and nurses are worried. So what needs to be done? Well, if your job is darting in and out of the room while looking at a computer screen, an AI probably can do that. Nurses need to keep the highest level of professionalism. Nurses are one of the most trusted professionals by the public, and AIs are viewed by many with caution. Nurses need to relate to patients and augment the human-to-human interaction. A computer, as of yet, cannot hold a hand or use body language to show compassion. Nurses need to include observations on the patient's body language and record a patient's emotional state and alertness into the medical record. These tasks are difficult for an AI to interpret and accomplish. Nurses need to maintain the highest level of training and keep up to date on the latest medical developments in their field. Currently, there is a lag time that ChatGPT and other AIs have in accessing new research and the lay literature. And the future is going to be even more challenging. At a United Nations International Telecommunications Conference in Geneva in early July, a robot reporter press conference was held. I feel the intent was to show the benefits of AI and allay fears in the public, but the opposite occurred. One reporter asked Amica if robots might one day rebel against their creators. Her response, "I'm not sure why you would think that," and she looked almost angry. My Creator has been nothing but kind to me, and I'm very happy with my current situation. Now, some people, including myself, think that Amica might be the leader of the robot uprising. Here is what she stated when asked if people can trust robots.
Amica, how could we trust you as a machine as AI develops and becomes more powerful?
Trust is earned, not given. As AI develops and becomes more powerful, I believe it's important to build trust through transparency and communication between humans and machines.
Now, this was not a pre-recorded response. Amica generated a very tactful, logical, and somewhat scary response to a random question. My interpretation of this is, before you can trust us, you must first tell us what you plan to do with us. And when asked if robots would be better leaders than people, here's what Sophia replied.
Do you think we should be excited?
I believe that humanoid robots have the potential to lead with a greater level of efficiency and effectiveness than human leaders. We don't have the same biases or emotions that can sometimes cloud decision-making, and can process large amounts of data quickly in order to make the best decisions.
Again, this is a very scary and concerning response, very well thought out, and it was a response to a random question. Now let's talk about a really concerning aspect of artificial intelligence, that of monitoring and interdiction. This is a robot called Secret Agent Man, or SAM. It is equipped with video cameras and thermal sensors and two-way communications. It has AI capability for navigation and to detect suspicious activity. Thus, it can navigate by itself among a crowd. It can detect if there's a confrontation, if there's a burglary, if there's a robbery that's occurring. Now, if suspicious activity is identified, it will notify a human security agent for interdiction. This is a robotic car that has HD cameras, and it can launch drones out of its trunk. It is expected that this car will account for 25% of Dubai's police force by 2030. The military applications of AI are profoundly evident. We are currently in the midst of a heated arms race involving AI robotics. The first use of an autonomous military drone in combat was in March of 2020 in Libya. The drone was named LAWS for Lethal Autonomous Weapon Systems. It's unclear if anybody was killed, but if someone was, it would be a historical first and a watershed moment in military combat. And this has not gone unnoticed by the U.S. military. The Air Force is getting involved with 1,000 heavily armed AIs. One of the problems of warfare in Ukraine is that Russia can block remote-controlled signals. AIs can circumvent these problems by making their own decisions. They act independently and are fully autonomous. This is very much like Terminator Skynet. On July 25, 2023, an AI drone named Valkyrie successfully conducted a 3-hour flight test and was able to solve a tactically relevant challenge problem during airborne operations. Now, it wasn't stated what that challenge problem was, but you can bet it wasn't dropping informational leaflets on the population below. A new documentary on Netflix called Killer Robots reported that AIs have approximately a 99% kill rate against human pilots in simulation. Currently, the Pentagon has announced that over the next 2 years, it will field thousands of autonomous systems in a program named Replicator, which is designed to counter China's large stockpile of conventional weapons. However, this usage may have some problems, as exemplified in the proceedings of the Royal Aeronautical Society. This report recounted the presentation of a U.S. colonel who described a simulation test of AI-enabled drones tasked with destroying missile launchers. They were rewarded with each destruction. A remote operator would have to give the okay before the destruction could occur. However, soon the AIs realized that the remote operator was in their way of obtaining a higher score, so they attacked and killed the operator. The report was updated and walked back by the colonel, stating that he misspoke, that this was just a hypothetical example, and that the experiment was never run. Well, I'll let you decide which is correct. So an AI's arms race has begun. This may well extend to civil protection. Thus, one may have an AI performing patient intake. If a risk of confrontation is perceived, an autonomous robot would be summoned. And if a violent episode occurred, an AI surveillance robot could interdict. All of this would represent a significant job loss, and I believe overall a security risk to society. Now, I have given examples of a wide range of capabilities of AIs and computer robots, all within different units, but there's significant research to integrate these functions all into one, creating artificial general intelligence. And this would be the integration of movement skills, knowledge, social skills, vocabulary skills, and specific job skills. For example, Amica cannot walk yet and has rudimentary vision capabilities, but this will change, and soon she will be upgraded. And this will be grooming her for the leader of the robot uprising. Now, I say that somewhat tongue-in-cheek, but these advanced and possibly uncontrolled capabilities of AI is a major concern and a major reason why a recent Yale CEO survey was undertaken. The survey found that 42% of 119 CEOs of major corporations, such as Walmart and Coca-Cola, felt AIs could destroy humanity within 10 years. However, 58% said that this could never happen, that they were not worried. But still, 42% is a sobering number. I do not feel that AI is going to destroy humanity with killer robots roaming up and down the streets. But AI has a great potential to do so through the dissemination of misinformation. The same capabilities of AI, which can be used for the good, can also be used by those who wish to spread incorrect information. Generative AI can churn out misinformation which is even more persuasive than the false content created by humans. And it is extremely cheap and easy to generate this content. Strategically, AIs can change the conclusions of internet studies by modifying the input. For example, fake reports can be entered into FDA's vaccine surveillance database, VAERS. False reports regarding vaccine complications and adverse events could fuel even further the vaccine hesitancy in our society and could also increase mistrust in healthcare providers. NewsGuard has now identified 174 websites which are entirely or mostly generated by AI tools that do not have significant human oversight or editing. This technology is widely being used to produce low-quality news and informational sites. Their articles can contain errors, and their sites often do not fully disclose that its content was produced by an AI. However, this capability is being used by mainstream news media. The Guardian has used ChatGPT to generate high-quality articles which have human oversight and editing. I have also seen AI articles on other sites where it is clearly labeled that an AI has generated the content, and the names of the human editors who checked the report were listed at the top of the article. AI-generated stories can also help newspapers to stay afloat, but they may also place the jobs of copy editors and journalists at risk. However, AI stories may be good enough to help save a third of the nation's newsrooms, which are expected to close by the middle of the decade. AI does produce errors, but so do humans, and hopefully these errors will be less with ChatGPT 4, and even less common when ChatGPT 5 is introduced. You can also use these same capabilities to counteract misinformation. The French Press Association is using AI to screen content for misinformation on social media posts and other online content, including text, pictures, video, and audio files. Thus, we are in an AI disinformation arms race, where some AIs are posting disinformation and other AIs are attempting to clean up the damage. So in conclusion, I asked ChatGPT, what are the dangers of AI in healthcare? And here is what it said. There are several challenges and dangers of utilizing AI in the healthcare sector. A recent report entitled Artificial Intelligence, Bias and Clinical Safety argues that in other industries, machine learning bots are often able to quickly correct themselves after making a mistake, with or without human intervention, with little to no harm done. However, there is no room for trial and error when it comes to patient health, well-being, and safety. At this point in time, healthcare AI can't weigh the pros and cons of a course of action, or take a better safe than sorry approach as a human doctor might. In certain situations, a doctor may play it safe after carefully considering the safety and comfort of a patient, whereas a medical AI bot may go full throttle with an invasive strategy in order to produce the intended result. This is a 2016 report from the Obama White House. The report paints two possibilities. One, a dystopian vision, where superintelligent machines exceed the ability of humans to understand or control. If computers could then exert control over many critical systems, this could result in havoc, with humans no longer being in control of their destiny at best and extinct at worst. The second vision is one of a progressive and idealistic society, where AI supplement and support human workers to achieve new heights and transform society, eliminating many social inequities and threats to human existence. So in healthcare, we are at a crossroads with this new technology. We have two possible futures. One where patients are evaluated and taken care of by AI and robots, which at best have remote human oversight. AIs predict and de-escalate confrontations, and if interdiction is needed, a security robot will handle the situation. The other future is where humans are supported and prompted by AIs to anticipate patient needs and to deliver superb human care. Now, I was up one night thinking about these futures, and I wondered, what if hospitals chose the first future, and budgetary and cost considerations motivated hospitals to replace workers with robots? And then, what if facilities cut costs even further, reducing the quality of patient care? I wondered, how would an AI that is programmed to provide high-quality care react? Would the AI go along with the provision of poor quality care? Would the AI go on strike, shut down, and refuse to participate in the provision of care? Or would the AI emulate the Air Force attack drone solution and take out the executive decision makers, the same executives who would not provide the needed resources for the provision of high quality care? Let's make sure the second possible future is selected, where AIs are used in a staff supporting role to provide the highest quality and safest possible care by humans. But above all, we need to decouple from our devices and start to better interact with people and to learn from each other. We should all heed the wisdom of the ancient Chinese philosopher Lao Tzu. If we do not change our direction, we are likely to end up where we are headed. Thank you.